Hi, this is Dr. Silvester, and I'm going to talk to you a little bit today about heel pain. Heel pain is one of the most common things that we see in our office, and I'm going to talk to you about the different locations where heel pain occurs and what that might mean. Certainly a professional diagnosis is preferred, but this might help you out at home to tell, you could look things up on the internet and see if that's what you have. And I'm going to walk you through the different anatomical locations on the foot, what kind of problems manifest themselves in those locations, and then you can kind of go forward from that. So let's look at this patient's heel, okay? The most common kind of plantar fascia pain, heel pain we see is plantar fasciitis. The most common condition that we see in our office is probably plantar fasciitis. And where that occurs is usually down here. It's usually on the inside of the ankle, inside of the foot, just below the ankle. It usually occurs, it's usually worse in the morning or after a period of rest. If you sit down for a while and then get up, this hurts, then that's usually plantar fasciitis. Okay, so if you want to see the plantar fascia, you just bring the toes up and then push right here. And in some people you can see it really well, but in her you can just feel it. She doesn't really have a prominent plantar fascia, but it's a pretty tight ligament right there. And if you follow it back, it hurts right at the heel most of the time. The reason it hurts at the heel is that's where it's the smallest. And as well, that is where it takes all the impact, because the heel, obviously bears a lot of weight. Sometimes it can hurt a little further into the arch, but most of the time plantar fasciitis occurs right there on the inside of the heel, just kind of past where the weight-bearing surface is and maybe extending back to the weight-bearing surface. The second thing that can cause heel pain, and I see this quite commonly, is nerve entrapment. Now this is the nerve tunnel, okay? It comes right in this area. So anyways, this pain is usually worse at night, or it's usually worse when you have been walking a long time and then sit down. It kind of throbs on you and stays with you for a while. Nerve pain doesn't go away real quickly. It sort of sticks around. Also, the nerve quality, the pain quality is different. This can be like an electrical, sometimes sharp pain, sometimes burning pain. The other problem that we see with this is a lot of times when you've had heel pain for a long time, with this plantar fascia pain, you'll start to get the nerve pain. But these two conditions can often go together. And we've had a lot of patients that have been to other doctors and they've been treated for this, and they've ignored the nerve, and they haven't gotten much better because they're ignoring the nerve problem, and you need to take care of that. Other things that can happen on the heel is your Achilles tendon, and that's right back here. And this is a condition that occurs from, sometimes there's a bump back here, sometimes it's just an insertion where the tendon inserts into the heel bone. It just gets inflamed. There's also a bursa back there. The bursa is usually a little higher. But the Achilles tendon problems are usually the same kind of thing. Worse in the morning when you first get up, when you first stretch it, it hurts. It hurts with activity. These can sometimes be quite swollen back here. And that's a miserable condition. That's a little tough to treat, and you need to, the best thing you can do if you start to get symptoms here is see a doctor quickly, because you don't want this to get going. If this gets going, that's a nightmare to take care of, and the surgery for that takes a very long time to get over. And it's a very tough kind of diagnosis to have. And so don't wait on this one. If you get this one, see a doctor quick. Anyway, so that's kind of the three most common things we see on the heel. There are other things that can cause heel pain, but this can help you sort things out. If you have plantar fasciitis, you can go on the internet, even our website, and look up different things you can do for that. If you have nerve entrapment or nerve irritation, you can do the nerve gliding and some ice right there. That'll help. And there are some suggestions to help you if you need to. If these conditions aren't responding to things you do at home, then give us a call and we'll give you some great treatments for it and try to get you back on your feet. Thanks for listening.